340B is a pharmaceutical drug expense reduction program. Entities that qualify based on certain rules from the government, they then can purchase their pharmacy drugs at a reduced cost.
We have some pretty large oncology infusion centers where the medications are extremely expensive that we use to treat our oncology patients. And many of those patients are uninsured or underinsured or have little ability to pay. And as a result, we can use the 340B program to purchase those medications at a substantially discounted rate.
In order to qualify as part of the program, have to be considered an outpatient. So anybody that comes in through our ED or is seen in outpatient surgery or even at one of our medical physician offices that are considered provider-based or a part of the hospital.
The 340B program is a perfect example where mission meets margin. As a result of the program, we've been able to expand access to patients that otherwise could not receive care. In addition to expanding access to those patients, we also have been able to expand our own services. In 2015, we hired 18 additional pharmacists in the St. Louis network. Those pharmacists are meeting with the patients at the time of admission and at the time of discharge and really managing them throughout their stay to allow for the safest medication processes that we can provide.
It's really extending that continuum of care and making sure that once they leave the hospital, leave their doctor's office, they have their medications and are able to care for themselves at home.
In 2008, if I remember correctly, our 340B savings on medication purchased were about $1.9 million. We're looking at, in 2016, we think that number is going to be about $33 million. So just in the past 3 or 4 years, the program has substantially grown and really has allowed us to offer increased access to patients who are in need.
With the 340B program, we have to have software that helps identify which patients and which drug administrations qualify so that when we repurchase the products used, we know, or the pharmacy buyers know, which products they can purchase at 340B. This involves IHT very heavily because they are the ones that are extracting the data out of Epic and sending it to the 340B software vendor.
The good news is it all happens in the background. A very busy nurse, a very busy pharmacist working from the central pharmacy simply doesn't have time to check all the boxes and do everything that you have to do to make sure you're compliant.
With being in finance, kind of like with IHT, I think it's very rare that we get to work in a program that does have such an impact to our end customers, which is the patient. And it's very fun to be a part of something like that, to know that we're really making an impact, not just to the organization, but to the community and to the patients.